I'm Dr. Brenda Heineke, owner and pelvic floor physical therapist at Revitalize Physical Therapy in Milwaukee, Wisconsin. We're launching this research study on the effects of pelvic floor physical therapy and its impact on delivery, and I am asking for you to be a part of this really important research. With the rates of maternal death, C-sections, and perinatal mood disorders on the rise, it has never been more important for us to find ways to decrease complications and trauma from childbirth. Now, before I get into the specifics of the study and why this research matters, can I tell you a short story? 3 years ago, I had a new patient in my office due to pain from a 4th degree perineal tear and a traumatic delivery with hours of pushing. Let's call her Megan. I treated her with pelvic floor physical therapy to resolve her pain, and she was able to get pregnant again, and we continued treatment up until delivery. Once she had the baby, Megan emailed me to tell me that she had no tearing and pushed for 20 minutes, which was so very different from her first delivery. As time went on and I worked with more and more pregnant women, I began to notice a similar trend. Each woman that I worked with prior to delivery had much less trauma, tearing, or an episiotomy. They spent a lot less time pushing than the average delivery, and they had a lower C-section rate with a better recovery with less pain. So I started to dig deeper into this topic, and I found that there wasn't a single research study that looked at the correlation between these outcomes and pelvic floor therapy. I also noticed that most women are told to do Kegels throughout their pregnancy. The idea being that it's necessary to have a strong pelvic floor in order to push the baby out. And this is where I really started to scratch my head. Let me show you on the model of the pelvic floor muscles. If I remove these superficial muscles, the levator hiatus is opening within the deep pelvic floor muscles through which the baby passes through during delivery. This opening must expand enough to allow for the baby to pass through. In order to do this, the pelvic floor muscles must be able to stretch and lengthen. In fact, they stretch to 2.5 times their original length. But when women do Kegels, the opposite occurs and the pelvic floor muscles tighten. I hypothesized that most women's pelvic floors were stuck in this contracted state, making it much harder for the muscles to stretch and push the baby through. As a result, this could lead to longer pushing phases, more tearing, and a higher risk for C-section, which in turn increase a woman's risk for prolapse, painful intercourse, incontinence, and low back pain. So I began to develop a study that would look at the outcomes for women when we performed manual pelvic floor physical therapy throughout their pregnancy, beyond just your perineal stretches. If our hypothesis is correct, this would open the door for women to have improved experiences with childbirth and postpartum recovery. The results from this study will help guide our recommendations and treatment for women during pregnancy. So, I'm asking you to please consider supporting this research. Your financial contribution will help offset the cost to carry out this study. If the project is fully funded, we will be able to significantly decrease the treatment costs for participants and be able to provide them hands-on, one-on-one physical therapy sessions for very minimal investment, if anything. Think of all the women in your life, a friend, coworker, sister, or daughter, who could have a more empowering delivery, an easier recovery, and ultimately a better long-term quality of life because of this research. Help us make an impact on the future of maternal health. Thank you.